If you've had diarrhea for more than a week, the kind that comes back after it seems to go away, the kind that leaves you exhausted for no reason you can explain, I need you to stop scrolling and watch this entire video, because there's a parasite that infects thousands of people every single year that most doctors don't test for on the first visit, that gets misdiagnosed as IBS, food poisoning, or just a stomach bug. And by the time it's caught, patients have already lost weeks of their life to it. It's called Cyclospora. Let's get one thing straight before we talk symptoms, because understanding why this parasite behaves the way it does is the key to recognizing it in your own body. Cyclospora cayetanensis is a microscopic, single-celled parasite, not a bacteria, not a virus, a parasite, which matters because it means your standard antibiotic won't touch it, and your body can't clear it the way it clears a typical stomach virus in 24 to 48 hours. You get infected by swallowing contaminated food or water, most commonly fresh produce like raspberries, basil, cilantro, or snap peas that were washed with contaminated water somewhere upstream in the supply chain. This is not something you catch from another sick person coughing near you. This is something you eat. And here's the detail that catches almost every patient off guard. After you swallow it, nothing happens for about a week. There's an incubation period of roughly 7 days, sometimes stretching to 2 weeks, before your body even shows the first sign of a problem. So if you're trying to figure out what made you sick, don't just think about what you ate yesterday. Think about what you ate 7 to 14 days ago. That's your window. Now, let's talk about what actually happens once that incubation period ends, because the way this illness unfolds is unlike almost anything else in gastroenterology. Symptom 1. The watery diarrhea that won't quit. Here's the symptom that brings almost every patient into my office, and here's the detail that separates this from a normal stomach bug. Ordinary food poisoning, ordinary viral gastroenteritis, that runs its course in 1 to 3 days. Your body fights it off. You're drained for a day and you move on. Cyclospora diarrhea does not play by those rules. This is watery, frequent, explosive diarrhea that can strike 10 or more times a day, and if left untreated, it doesn't resolve in days. It can drag on for weeks to months. I have had patients describe symptoms lingering for over 57 days without treatment. What makes it distinct clinically is the pattern. Patients frequently describe a cycle. The diarrhea seems to ease off for a day or two. They think they're recovering, and then it comes roaring back, sometimes worse than before. This relapsing, remitting rhythm is one of the biggest clues that points away from a simple viral bug and toward a parasitic cause. If you remember nothing else from this video, remember this. Diarrhea that keeps returning in waves, week after week, is not normal, and it is not something you wait out. But the diarrhea is only the opening act. What comes next is what genuinely surprises people, because it doesn't feel like a stomach illness at all. Symptom 2 and 3. The fatigue that feels like something else entirely. This is the part of the video I most want you to pay attention to, because this is where misdiagnosis happens. Alongside, or sometimes even before, the diarrhea escalates, patients report a profound, almost disabling fatigue. Not "I need a nap" tired. I mean the kind of exhaustion where climbing a flight of stairs feels like running a marathon. Patients tell me they can't concentrate at work. They're calling in sick. They feel like their body has simply stopped cooperating. Paired with that fatigue is severe loss of appetite. Food stops sounding appealing at all, sometimes to the point where patients are barely eating anything in a day. And when you combine relentless diarrhea with someone who isn't eating, you get the next inevitable consequence: weight loss, often significant, often within just a couple of weeks. Here's why this combination fools people, including some doctors. Fatigue plus appetite loss plus weight loss looks like a dozen other conditions: anemia, thyroid problems, depression, even early presentations of more serious chronic illnesses. Patients get sent for blood work, sometimes imaging, sometimes referred to specialists entirely unrelated to their gut, when the actual answer is sitting in a stool sample that nobody ordered yet. If you're dealing with diarrhea and this bone-deep exhaustion at the same time, that combination itself is a signal. Don't let anyone treat them as two separate, unrelated problems. Now, I promised you the symptom that catches people off guard. We're getting close, but first, let's talk about the abdominal symptoms that usually accompany all of this. Symptom 4 and 5. The cramping and the nausea. Underneath all of this, most patients are also dealing with abdominal cramping and bloating, a persistent gnawing discomfort that tends to intensify right before an episode of diarrhea and eases slightly afterward, only to build again. And riding alongside that cramping is nausea, sometimes progressing to actual vomiting in more severe cases. It's not usually as violent as classic food poisoning vomiting. It's more of a low-grade, persistent queasiness that makes eating even less appealing, which only deepens the appetite loss and weight loss we just talked about. This is where the illness starts to compound on itself. Diarrhea leads to dehydration. Dehydration worsens fatigue. Nausea kills appetite. Lack of appetite worsens weight loss. It becomes a downward spiral that patients describe as feeling like their body is shutting down. And it's precisely why untreated cyclosporiasis can become genuinely dangerous, especially in older adults, young children, and anyone with a compromised immune system. Now, I want to address something you might be feeling right now if you're watching this and recognizing your own symptoms. Yes, this can feel alarming, but this condition is treatable, and I'll walk you through exactly what treatment looks like later in this video. Right now, let's talk about the low-grade fever most patients don't even notice is connected. Is something else wrong with me? In a subset of patients, even after the gastrointestinal symptoms have started to calm down, there is a well-documented phenomenon of post-infectious reactive symptoms, joint pain, and in some documented cases, inflammation of the eyes or thyroid-related complications, appearing days to weeks after the initial infection seems to be resolved. The reason this happens is that Cyclospora can trigger your immune system into an aggressive inflammatory response, and sometimes that inflammatory response doesn't shut off cleanly the moment the parasite is cleared. Your immune system essentially keeps firing at low levels even after the main threat is gone. This is exactly why I tell every patient recovering from Cyclosporiasis, don't assume you're finished the moment the diarrhea stops. If you develop new joint pain, unusual fatigue that returns after you thought you'd recovered, or any new symptom in the weeks following your recovery, go back to your doctor and specifically mention your recent Cyclospora infection. Most general practitioners won't automatically connect a new symptom 3 weeks later to a gut infection that's already resolved. You have to be the one to make that connection for them. This single piece of information has saved my patients from unnecessary rounds of testing for unrelated conditions, simply because they knew to mention the timeline. Treatment and recovery. The good news, and I want to end on genuinely good news, Cyclosporiasis is treatable and most patients recover fully. The standard treatment is a course of trimethoprim sulfamethoxazole, commonly known as Bactrim, an antibiotic combination that, despite this being a parasite rather than a bacteria, has proven highly effective against Cyclospora specifically. For patients with a sulfa allergy, your doctor has alternative options to discuss with you. Alongside medication, hydration is non-negotiable. With the volume of fluid loss we discussed earlier, oral rehydration solutions, not just water but fluids with proper electrolyte balance, are essential to prevent the dehydration that makes every other symptom worse. Most patients begin feeling improvement within days of starting appropriate treatment, though full recovery of energy and appetite can take additional time given how depleted the body becomes during the illness. Prevention. So, how do you avoid this in the first place? Wash fresh produce thoroughly, even when it's pre-washed. Be especially cautious with imported berries and fresh herbs. When traveling to higher-risk regions, stick to bottled water and thoroughly cooked food. But here's my final message to you, and it's the most important thing in this entire video. Your body does not create a week of relapsing, wave-like diarrhea for no reason. If what I described today sounds like what you're going through right now, this is not something to wait out, and it's not something to self-diagnose as just a bug. Screenshot the symptom list in this video. Bring it to your doctor. Ask by name for Cyclospora testing. That single request can save you weeks of unnecessary suffering. If this video helped you understand what your body might be trying to tell you, subscribe. Because next week, I'm covering the parasitic infection that's even harder to diagnose than this one, and it's hiding in a food you probably ate this month. I'll see you in the next one.